Welcome to Ask an MS Expert Veterans Program. My name is Emily Riley, and I'm the moderator for this wonderful program. I'm a proud Air Force wife, dog mom, certified personal trainer who teaches adaptive fitness classes for the MS community, and I've been living with MS for almost 17 years. I am located in Alexandria, Virginia, and currently work for the National MS Society as a local healthcare provider engagement manager. Thank you for joining us. The National MS Society is committed to offering a place to connect and ask questions to MS experts on topics impacting veterans affected by MS. We will also highlight important resources and services available through the VA. MS navigators are online throughout the program answering questions and providing resources, so please post any questions or comments you may have in the comments box on YouTube. So today we'll be talking about how to support your cognitive and mental health wellness based on what matters to you, not what is the matter with you. We will discuss strategies and resources to help you partner with your doctors to customize your care based on your values, needs, and goals. So let's meet our experts for today. Terry Lee-Wilk, Ph.D., is the Director of Neuropsychology at the VA Maryland Healthcare System and at the VA MS Center of Excellence East in Baltimore, Maryland. Moira Dux, Ph.D., is the Psychology Training Program Director at the VA Maryland Healthcare System and a staff neuropsychologist. Well, welcome. Thank you, Dr. Lee-Wilk and Dr. Dux, for being with us today. It's so fun to see you. Thanks for joining us.
For inviting us. Thank you.
Thank you.
All right, so the Veteran Administration is changing the way healthcare is provided to veterans with an approach called whole health. So what is whole health, and in your experience, is this model well received by veterans, and is it effective?
Thank you so much, Emily, for that question. As you just said, whole health is all about not what's the matter with you, but what matters to you. So often within medicine and healthcare, it's been this approach versus that approach. And what do I mean by that? It's traditional or conventional medicine versus complementary and alternative approaches. It is medical care versus mental health care. The VA's whole health approach to care is really a framework for thinking about your health and overall well-being. And it's not this or that. It's an integration among you, your healthcare providers, your community that you're in, your friends, your family, your community organizations, and finding a path for doing what's important to you for your own health and well-being, and really having a collaborative stance among these different players that play an important role in your healthcare. So again, it's not conventional medicine versus complementary and alternative approaches. It's finding a pathway for being able to integrate these different approaches and these different sources in a way that's as unique as you are.
I love that. Sounds very customized. So what kind of healthcare professionals are part of this whole health team?
I mean, essentially, all healthcare providers can be part of this team, and we would actually argue that they should be part of the team. This is a program that is, created by the VA, and really all members of the VA are trained in this approach. So I would say that all individuals should really be part of this approach.
That's great. So what if a veteran doesn't really know what their goals are or what they want to work on? Is there some sort of an assessment that can help someone figure this out?
I can say that when I first meet with my veterans, I usually spend some time getting to know them, ask a lot of open-ended questions. What are their values? What are their goals? And a lot of times individuals will really know what they are right off the top. Here they are, this is what's important to me. But at other times, they have more difficulty identifying those values and goals. I even had one veteran tell me in a group, I'm used to being a soldier and being told what to do, when to do it. And so for you to be asking me what's important to me and what I should do, that's really challenging. So we do have some tools. Dr. Dukes will talk a little bit about one of our tools.
Yeah, thank you so much, Dr. Lee-Wilk. So as you just mentioned, so often when we're working with veterans, the starting point is with you. We want to know what matters to you, who you are, what are your different identities, how do those impact what your values are, your goals as they relate to healthcare and otherwise. And sometimes those conversations can start right away when you're meeting with a provider, and sometimes it takes a little bit of time. So we want to have different avenues for veterans being able to consider their identities, goals, needs, and values. So one of the tools that is so helpful and is available on the VA's Whole Health website, and we'll be sharing that later today, is something called a personal health inventory. So this personal health inventory is just about a 2-page assessment. You can use it in a way that is most helpful for you. So for some people, that can be doing the whole assessment from start to finish. For others, it might be doing parts of it now and then flagging it to complete later. So really finding a path that works the best for you. So let's talk a little bit more about what is this assessment. So this personal health inventory starts with an overview of what is the VA whole health model. We'll be displaying a graphic in a little bit that goes over a visual representation of the model, but essentially the model starts with you in the center. And so this inventory is to assist you in determining what's important to you. So it starts off with doing a rating of different aspects of your health. Again, we want to think about health in a really integrated way. So physical health, mental health, spiritual health, not as separate entities, but entities that interact. So the questionnaire starts off with you giving a rating from 1 being low or not so good to high or great, for 5 regarding your physical well-being, your mental and emotional well-being, and then how is your life on a day-to-day basis. Thereafter, it asks you what matters to you in your life right now. We recognize that what our priorities are definitely shift and evolve over time. So this kind of health inventory can be used at different parts in your, different points, in your healthcare journey. The next section, the second page of this personal health inventory, asks you to rate what we consider to be some building blocks of health and well-being. So different self-care and coping strategies. And so, for example, food and drink, and just doing a rating of where you are now and where you want to be in the future. Who's part of your self-care? So family, friends, coworkers, and again, doing a rating now versus where you hope to be in the future. And then there are some items to help you reflect upon the ratings that you've done. So I'll just say to you that this can be a really useful tool that you can use at home on your own to think about what's important to you in terms of your health. And then you can bring this in to different providers. I would suggest starting with a provider. Dr. Lee-Wilk said that all providers within the VA are well versed in the whole health model. So a provider that you feel really comfortable with starting these conversations, if they haven't already started these conversations with you, and using this personal health inventory as a way to just facilitate some of those important and ongoing discussions.
That's great.
And just to add on to that, just one point, it's really important to know that as Dr. Dukes mentioned, this is a process that evolves over time. Your goals and your values may change from one year to the next. Mm-hmm. So it's important to then reevaluate at various points.
Absolutely. You mentioned a graphic, which we'll put up on the screen. So can you tell us a little bit more about that, the circle of health? And I know you mentioned a few of the self-care practices, but can you give some examples of some of these self-care practices that are really important to the whole health approach?
Sure. So thank you for putting up the graphic. You can see there, it's a visual representation that can be used by clinicians and patients alike to conceptualize all that whole health represents. Mm-hmm. It's really another tool that can guide the process, something that you can bring in again to talk to your provider about, thinking about your health and all the different circles of self-care. This is something that, some veterans have actually carried around in their back pocket just to sort of, reference when they go to appointments.
So great. So we heard from Danielle, who says she's doing really well adjusting to civilian life. She's healthy, she exercises daily, and she just started a new job. So she's wondering if whole health is used in only certain situations or with certain conditions, or can anyone use it?
Anyone can use whole health at any point in time, and this is really meant to be infused in all aspects of VA healthcare. So it's not limited to a specific veteran or condition or illness or symptom or disability status. So we would really encourage veterans to use this in collaboration with their care partners, to include those within the professional healthcare community as well as their own communities throughout your healthcare journey and process. So in Danielle's situation, it sounds like she's doing really well right now. Well, this is still a time where whole health can be helpful to just think a little bit more and reflect about healthcare goals. And doing really well is great. And maybe there are some other ways in which Danielle is hoping to grow in terms of self-care and health-related goals, and can use discussions with providers or the personal health inventory to help facilitate those goals. On the other hand, if you're feeling like you're not doing well in terms of your health at this point and you have some concerns, it's also an appropriate time to use some of these resources. And again, VA Whole Health can be used at any time for anyone. And as Dr. Lee-Wilk said before, we argue that all VA providers should be using this in all this framework in all interactions with veterans with whom they're working.
So it
Some
sounds
might say that when you're feeling healthy is the time to actually work on these things. And you have the bandwidth to really think about your goals and where you want to go, versus when you're at a time when you're down, for example, or sick.
that proactive approach.
Yes, I just wanted to add one thing to that as well. So I think there are so many great whole health resources, but sometimes when there are 8 different areas of self-care, for example, that can feel a little bit overwhelming. And maybe when you're working with a number of challenging health circumstances at one time. So we also really want to encourage and empower and invite you to use whole health in a way that works well for you at a given point in time. So when you're experiencing more health challenges, you might focus on one aspect of self-care that you would like to enhance, versus feeling like you have to address all 8 areas at once. So really kind of taking it and calibrating this approach in a way that's most fitting for you based on your current circumstances and goals. And as has been mentioned before, recognizing that those will evolve over time.
So it sounds like veterans, anyone can access whole health. Is this approach offered at all VA sites?
Anyone can access whole health, and it's an approach that is offered at all VA sites. You would go to the VA website and search up whole health, and you'll see a whole host of resources, including podcasts and videos. I can say that some veterans have really enjoyed hearing about the experiences that other veterans have had, listening to different podcasts, and that really has spurred them on and really encouraged them to really want to get on board and look into whole health for themselves.
Sounds like this approach it really is empowering and individualized. So is there any other reason why you feel like this approach is so important for veterans to be able to tap into?
Yeah, I think those are some of the key elements. But I think what's really great about this model too is it's a departure from some of the traditional healthcare models where it's healthcare providers telling you what to do and sometimes not telling you why to do those things. This is really a collaboration. And it's, again, just providing some tools and some pathways for being able to effectively collaborate and communicate with one another, and recognizing the different roles that you and others play in your healthcare. And so having a more equitable approach to healthcare, I think really speaks to that communication and collaboration, but also recognizing that an approach that works well for one person might not be fitting for someone else. There are so many differences among us. And so having a pathway for being able to consider different goals, considerations as it relates to mental health, and coming up with a customized healthcare plan makes so much sense. Part of the VA's whole health care model, and a lot of this information is available on the website too, it will continue to evolve over time because the science, the research changes. And so this provides information about some conventional healthcare approaches and things that might be fitting for a specific condition in some circumstances. For example, there are some post on the VA Whole Health website about multiple sclerosis specifically that cites information about some conventional treatment approaches and the empirical or research base, as well as some complementary and alternative medicine approaches for addressing a range of symptoms associated with multiple sclerosis. So I would anticipate, and it's already been the case since its existence since 2011 of the VA Whole Healthcare model, that this will continue to change. So I'd also invite people to reference the VA Whole Health website in an ongoing way, maybe bookmark it, because it will continue to build over time.
I think that is a really important point, Dr. Dukes. It's not like this is something that has been made up. It's really evidence-based. There's a lot of medical literature that goes into the intervention and the approach, and this is something that's dynamic as well and changes over time. So it's definitely a good idea to check back and see if there are any changes over time, what improvements are being made.
So now that we've talked a little bit about whole health, we'll shift gears just a little bit and talk about cognition and mental health. So more than half of all people living with MS may experience problems with cognition at some point during their journey, and we know that MS can also affect mood. These are really important topics, and both have been under-recognized and undertreated in people living with MS. I know I myself experienced cognitive challenges, so I'm really excited to learn a little bit more about this. So are cognitive problems common in people living with MS?
Absolutely. I can tell you that up to 2/3 of individuals with MS will experience some cognitive symptoms. So it's certainly a significant issue that impacts, daily function and quality of life.
So what are the most common cognitive symptoms in MS, and is there anything that can be done to treat these?
Yeah, so as we've been talking a little bit so far today, everyone's experience with health challenges is unique. And so there are some common cognitive symptoms, but I certainly want to make the point that what your experience might be could be different from this. So slowed down thinking can be one of the more common challenges associated with multiple sclerosis. Another cognitive area of challenge can be learning new information. So what we've often found in terms of some of the research studies is that memory itself is okay, but it just takes a little bit more time to take in new information before it's sort of transitioned from short-term to long-term memory. And then another area that's commonly impacted is something called executive functioning. So this refers to things like problem solving, multitasking. Again, however, multiple sclerosis can be associated with a range of cognitive symptoms, and each person's experience is unique to a degree. Another thing that I want to highlight to you, as has been mentioned, cognitive and psychological symptoms have often been under-recognized and undertreated in individuals with multiple sclerosis. Although there's variability in most, cognitive symptoms and psychological symptoms can occur early on in the disease course and can persist over time. For most individuals, the cognitive symptoms are considered to be mild in nature. So I think that's an important point to make, because when we think about cognition and thinking skills, a lot of times we jump right to things like dementia, Alzheimer's disease. And so not to say that individuals with multiple sclerosis can't develop dementia related to neurologic or other conditions, but dementia and that level of cognitive impairment is not what's most typical. So we're talking about symptoms that are milder. However, these symptoms have an impact, and they've been shown to impact quality of life, things like occupational status. They can also really impact one's sort of self-confidence. And so I think having conversations about cognitive symptoms and psychological symptoms is so important. And part of that conversation is just normalizing the experience and really finding that balance between addressing symptoms, but then also finding ways to work around them to lead the most fulfilling life that's aligned with one's goals and values.
Yeah, you kind of mentioned that this can happen at any point in the disease course. So why do people with MS experience cognitive challenges? Are there actually changes in the brain that cause this?
Yeah, so there are changes in the brain that are associated with some of the cognitive changes that are most common in MS. And so, kind of thinking back, MS was historically viewed as a condition that affected the white matter tract, so the connections between different brain regions within the brain. But over time, it's been recognized that it also affects gray matter. Mm-hmm. And so these different brain changes can contribute to and underlie some of the cognitive changes. But I think one thing that's really important too is to recognize that there might be other factors too. So as providers and providers specifically that assess cognitive and psychological well-being, we try to understand what MS specific factors might be impacting one's thinking skills and psychological function, but not stopping there and considering, are there other health conditions or circumstances that might be playing a role as well? So I think it's important too to discuss comorbid medical and mental health conditions and the role that those could play in cognitive symptoms and psychological symptoms, with the ultimate goal being trying to recognize the symptoms that exist, how they impact one's day-to-day life, and then finding different approaches, and again, a range of approaches for being able to address those symptoms over time.
Yes. And Dr. Dux just mentioned the comorbidities that's so important to look at. Just as an example, individuals with MS may have fatigue or difficulties with sleep, depression, and those are all things that are modifiable. We can do treatment for sleep, like cognitive behavioral therapy for insomnia. And we've definitely had individuals come through treatment for CBTI, cognitive behavioral therapy for insomnia. And really once their sleep was sort of fixed, their routines were better, they were able to feel better cognitively. So it's really important to look at those factors that could be potentially modifiable. So just because you do have some cognitive symptoms, it doesn't mean that there's nothing you can do about it. There are things that you can do.
Yeah, kind of going back to that individualized, customized approach, really figuring out what each person is going through. I think that's so important. So we talked a little bit about cognition, and so let's talk a little bit about emotional health now. So what are some of the common mood changes in MS, and can you talk about some of those strategies to help manage those emotional changes?
Sure. Some common emotional symptoms include anxiety and depression. In fact, estimates vary between about 30 to 50% of individuals may experience symptoms such as depression and anxiety. Rates of psychological distress for people with MS are higher than the general patient population, higher than those with chronic illnesses as well.
So a lot of people living with MS have learned that practicing behaviors that promote resilience is the secret to not just coping with MS, but thriving with it, which I really love that. So what is resilience, and why is it important to incorporate in our daily lives?
Well, resilience is certainly a complex construct, and I feel like there's not, universal agreement on a single definition. But the way that I sort of think about resilience is the ability to persevere in the face of challenges, and challenges of a wide variety. So we might be talking about health challenges, psychosocial challenges, etc. So kind of consistent with what we've been talking about in terms of the VA's whole health approach to care is finding some of those self-care approaches that might be really fitting for you at a specific point in time and for different challenges that you might be facing. Part of this too is trial and error over time. There might be things that are particularly effective at one point in time, like kind of feeling down and isolated and making intentional steps towards connecting with family and friends and, relationships and connections that really bring you a lot of joy and motivation. And then there might be other times in which different self-care strategies are effective. Also, too, recognizing, as we've been talking about, that there are a range of approaches that can be helpful, both conventional and complementary and alternative, for a variety of symptoms. So sometimes thriving is through moving your body in ways and following an exercise regimen that's helpful not only for your physical function, but also your psychological and cognitive function. And so I think that's in part the key, is finding some of those strategies that don't lead you to feel overwhelmed, but they lead you to feel invigorated and address a number of symptoms, sometimes simultaneously. I think another really important part of resilience, though, is recognizing that there might be some symptoms that you experience, some healthcare challenges that aren't optimally addressed by conventional, complementary, and alternative and or self-care strategies. And so sometimes in those circumstances, it's about reflecting upon what you're experiencing and having some level of acceptance and really self-compassion. I don't want to give this message that, just follow all of the 8 self-care and every symptom that you experience or every health challenge will, be something that's easy to address, because there are times when that's not the case. And I think, again, recognizing self-compassion in that process and some level of acceptance for aspects of healthcare experiences and journeys can be really important part of this too.
And also I'd add that recalibration of goals is really important. It may be acceptance is part that happens, and then you have to reevaluate and sort of go back to the drawing board and say, what's realistic? I've done all that I can to help myself with my healthcare. I can't control everything with my disease. I'll do the best that I can. I'll be self-compassionate, which is hard for a lot of people, but that's something that's really important to do. And then sort of go back to the drawing board and, reevaluate your goals for something more realistic, with acceptance in hand.
Dr. Lee-Wilk, you had kind of mentioned a little bit, you touched on depression a little bit. So studies have suggested that clinical depression, like the most severe form, is more frequent among people with MS in both general population and in other chronic illnesses. So you talked a little bit about this, but what should someone do if they do feel depressed?
Sure. So if not already engaged in mental health treatment, I think a good place to start would be, your primary care provider or your neurologist, your MS nurse, to just go ahead and say, look, I'm feeling down and blue. What can I do? Can I get a referral to mental health? So that would be the first place to start. If you're in a crisis, of course, you may want to go to the emergency room, call the VA crisis hotline, which will have the information at the end of the slides, but essentially the transition number is 988 and press 1 if there is indeed a crisis. But other than that, I think just going to your primary care provider and requesting help is the first step. And I think oftentimes the hardest step.
Right. Yeah. So it sounds like it can be a little confusing differentiating between maybe mental health symptoms and and cognitive changes. So is there a link between the two?
There can be a link between the two. So like we were talking about before, some of the cognitive changes that individuals may experience can be directly related to some of the changes that MS leads to in different areas of the brain. The same can be true for some of the psychological changes. But again, as discussed, there can be other factors that are playing a role too. So I think as providers and psychologists, one of the things that we really try to do is take a holistic approach to understanding what symptoms you're experiencing and what they might be related to. So I think that that's a great starting point, and that can really reveal different points of intervention and different approaches to intervention that might be customized and most appropriate for that person at that point in time. Dr. Lee-Wilk mentioned a few approaches to psychological intervention. And what's really great about some of the approaches when there's a holistic assessment that's done up front is that multiple things can be addressed at the same time. And there might be different priority levels among them, but things like sleep and fatigue, pain, changes in thinking, like feeling slowed down, like not able to, think as quickly maybe as you were once able to do, or not able to multitask as effectively. So there are different forms of behavioral or non-pharmacologic or non-medicine-based, medication-based treatments that can help to address some of these types of symptoms simultaneously. And by assessing throughout the treatment course what's working and what's not, it provides this opportunity for providers, mental health care providers, to, I'll use a term that Dr. Lee-Wilk just used, recalibrate. Mm-hmm. So when one approach isn't working and it's not having the intended effect, then kind of switching gears a little bit and trying some other approaches, because there are really a range of approaches that can be helpful for different types of symptoms.
I think really common is, as Dr. Dukes mentioned, mood symptoms, cognitive symptoms, fatigue, and they're all interrelated. Treating one area may impact the others. It makes, it's a perfect, chronic illness is perfect for whole health because it's dynamic, it's changing all the time. So you do have to, recalibrate, you do have to, reevaluate at different points. I'm working with someone right now who has both anxiety and, sleep difficulties and fatigue. And part of, his treatment plan is finding out like what is your primary, like if you had to pick one thing to start with right now, what is bothering you the most? And for him, he said it was his sleep and he wanted to start there. And yes, anxiety is important as well, but is hoping to do that sort of as the next step because it was too overwhelming to kind of do all parts at once. So that's just an example of, asking what would be most helpful to you.
Mm-hmm. Yeah, it sounds like it's like constantly going back to that whole health framework and reevaluating. It sounds like such a helpful tool, especially when you can apply it to cognitive health and mental health. So do you have any other examples aside from this gentleman about how it's been beneficial for people?
Yeah, I would say that, for me and reflecting upon my professional experiences as a psychologist and neuropsychologist, it's really integral in our practice and our training to start with the individual and recognize the differences that can exist among individuals and not making assumptions about what will work and why it will work, but really facilitating collaborative discussions and inviting veterans to share about who they are and what matters to them and have these in an ongoing way because those things change over time. So I think with the VA's whole health model, it just so perfectly aligns with this, but it does offer additional language and tools. Mm-hmm. And the website, I feel like I'm mentioning that a lot, but it just has so many different resources. And again, this is something that will continuously be updated over time. So I do think that it makes for some more actionable ways to address whole health. And two, it kind of has this shared framework among all of us within the VA to include veterans, professional members of the healthcare team, and anyone else who's important in the veteran's life, to include the community. So it's really been helpful, again, to put some more language and tools and resources on a framework and an approach to patient care that is really just consistent with psychological practice.
And I can give another example. In our clinic, we have a range of support groups or cognitive wellness groups for individuals with MS. And these have been really well received. And we do take a whole health approach by asking. It's hard with a group because everybody's going to have their own unique kind of goals and values, but they learn a lot from sharing their goals with one another. And also we always ask for feedback, what would be helpful to you? So we've had programs on MS and exercise. We've had programs on MS and nutrition, chronic pain and MS, sleep and MS. So it's really driven by the veterans in our clinic and what they're interested in and what goals they have. So if they're, not interested in the chronic pain one, they can skip that, session. If they really want nutrition, we even invite a lot of providers to come and speak, experts in their field, rather than, just being the expert of everything. We're not. We do invite, nurses and neurologists, exercise physiologists, PT, OT to come and talk about their, areas of expertise and let veterans ask questions, that would be helpful for their individual health plan.
Yeah, I just wanted to build upon something that you just mentioned, Dr. Lee-Wilk, this word of expert. I think one of the things that's really beneficial about the VA whole health model is that many experts are involved in the process. And absolutely at the center of that process is the veteran as an expert about themselves. And again, it's this departure from some of the traditional healthcare models where they're more directive and it's the healthcare expert saying, do this because I said to do it, and kind of ending the conversation there. It's really an ongoing collaboration and recognizing that there are so many different people and groups that have expertise about different things that together, the sum greatly exceeds the the parts in terms of supporting one's healthcare journey.
Yeah. I love that you're kind of giving the choice back to the veteran and like where they want to go. So I think that's so great. So we talked a little bit about how cognition and emotional health sometimes are under-recognized or undertreated. And so why is it important to build awareness about cognitive and mental health, and how can they impact someone's life, whether that be negatively or they can kind of get a good handle on it, how that can impact their life too?
I think we touched a little bit up on this earlier, but essentially it does affect daily function. It does affect, mood. It affects, quality of life and all of the things that are important. So, I think those are the reasons it's really important to raise awareness. It's underappreciated at times, underdiagnosed, and all of those things we mentioned earlier. So by raising awareness, not only to veterans, but to the providers, I think that's a really key part of it. We at our VA do a lot of in-services and have little educational handouts for our providers as well. So we're all learning and we're all, trying to do our best for veteran healthcare.
So in 2003, the Department of Veterans Affairs established the VA MS Centers of Excellence. These centers collaborate with VA providers to make sure veterans get the best care possible and have access to the various resources available within the VA. So I'm curious, how many MS Centers of Excellence sites are there, and how does someone find out if there's one near them?
Sure, I can take that. So there's MS Centers of Excellence East and one on the West as well. Those are the main sites, but they're across the country. There are 37 different regional programs. So what we usually do is direct veterans and staff to the MSCOE website, which is www.va.gov/MS. Will also be in our information later. But on the front page, you just click on the MS Regional and Support Program to see your location and find resources from there. So again, going to the website, looking that up, and that area can help you know where to go next.
And what type of healthcare professionals are available to help veterans, and how is care coordinated between the various services within the VA?
Yeah, so any discipline that is involved in MS healthcare can be accessed. So neurology, nursing, social work, psychology, urology, PT, you name it. So all of the services are available. The next step is for the providers to really, communicate and collaborate with one another so that they're very much aware of each individual healthcare plan. So essentially, I think it's the onus, a big part of the onus is on providers to really communicate. One point I also want to emphasize is that veterans can be encouraged to be their own advocate if they're not getting something in their healthcare that they want, to not just shy away from it, but to really ask for it, and finding their voice and being empowered to do so can be hard, but it's really encouraged, and whole health is like one way to really kind of push that forward.
Yeah. I'm sure there's some veterans watching right now who might be hearing about whole health for the first time. And it sounds like Mark says he really likes what he hears about whole health, and he's interested in learning more and possibly starting the program. So where can Mark find some more information about whole health, and how does he get started?
So I would say that the best place to start is what's shown at the top of this slide. So with the VA Whole Health webpage. So this is a webpage that can be accessed from anywhere. We recognize that different people have different levels of access to websites. So for example, if you don't have a computer, you don't have a smart device that you can access this website, you can go to your local VA, or you can go to a local library to access this website. It really is the place where all of this information exists for veterans as well as members of the professional healthcare team. As Dr. Lee-Wilk said previously, we're all learning and growing together, and things will continue to change as we understand more about overall health and different facets of health and ways to address healthcare goals. So going to the VA's Whole Health website has all the resources and tools that we've mentioned today.
And Dr. Dukes, you had mentioned a really helpful assessment tool, the personal health inventory. And Shonda's wondering how she can access this so that she can learn what areas of self-care that she wants to focus on.
Absolutely. So Shonda, I would suggest, again, going to the VA Whole Health website. So you'll see on the left-hand side of the website, it has the resources organized. You can click on for veterans, and then you'll see a link for the personal health inventory. There's also a lot of information and presented in different ways. We recognize that we all learn in different ways, and we might have different preferences about learning strategy. So there are some handouts, there's some written materials, there are audio and visual materials as well to learn more about whole health and the different components, as well as ways to become involved and engaged with whole health if not already a part of VA or whole health plan.
So if this is an opportunity, Amy wants to become a trained peer facilitator for whole health. Is that something that they can do? And where can she find more information about getting involved that way?
Absolutely. So peer facilitators, even prior to whole health, have been really an integral component of VA whole health care. So recognizing that veteran peers have an important voice and role in the healthcare of veterans. And this can be be done in collaboration with other providers on the team. So there are specific links for peer facilitators on the VA Whole Health website. There are some introductory videos that go through more training about what it means to be a peer facilitator. There are some testimonials from existing peer facilitators, and much of this information can be accessed online. So some of the initial trainings, and then those provide a pathway for becoming a peer facilitator as part of the VA Whole Health Care team.
That's so great. I'm sure there's a lot of just great conversations when you have that shared experience as a veteran, being able to talk with your peers. So I love that that's an opportunity for someone. So the VA has a variety of mental health resources, some which you've already mentioned, information, treatment options, and more, all accessible to veterans, veteran supporters, and the general public. So I know you mentioned earlier a number, and it's here on the screen, but if a veteran is in crisis or someone is concerned about a veteran's mental health, what are the first steps to get help?
Yeah, so certainly if a veteran is in crisis, it's really important to act immediately. Going to the resource that's on the page here, the VA crisis line, take note of that number because that's recently changed from July. It just started on July 16th of this year, 2022. So it's 988 and press 1. That has recently changed. So that's important to know. If the person is not in acute crisis, seeking out mental health treatment, going to the primary care provider and requesting a referral would be my recommendation as to the next step.
Yeah, and I'll just add too that on the Whole Health website, let's say that you're interested and eligible for VA care, but you haven't enrolled in VA care at this time, there is an opportunity to include your information. So you can go to Find Services Near Me, there's a locator, you just type in your zip code, and from there it will populate with VA centers that are close to your zip code. So you can learn more about the whole health services that, like I mentioned, are sort of infused in all aspects. It's more of a framework for approaching healthcare versus a specific intervention or offering at a VA, and it is offered and incorporated in all VA healthcare. But what this link also provides is information and links to various VA's websites. And so, for example, when you're on, let's say, the VA Maryland Healthcare website, from there you can go to different aspects of care to include mental health. And you can click on links to learn more about what are the specific mental health care services that are available at that specific VA, what are the points of contact, what are the ways for becoming engaged, and you can also learn to, if not already enrolled in VA care, about the steps to take to become enrolled in VA care and to establish primary care through the VA system.
That's really helpful to know. Great. So the National MS Society partners with the Department of Veterans Affairs, MS Centers of Excellence, to improve care and expand resources for veterans living with multiple sclerosis and their families. So the Society has several resources to help veterans living with MS. So Dr. Dukes, can you tell us a little bit about some of those resources?
Absolutely. So the MS Navigator program provides answers to questions and access to information about all the options available to people living with MS, including veterans. So you can connect with an MS Navigator via phone, email, and through the Society's website via chat. So this like Ask an MS Expert Veterans program is also a great resource for veterans living with MS. This program takes place 4 times per year and can be found on demand on the Society's website or on the YouTube channel.
That's great. And Dr. Lee-Wilk, does the Society have any self-help groups or support groups for veterans living with MS?
Absolutely. Connections programs like self-help groups, MS Friends, and the National MS Society community in Facebook. To find a group just for veterans in active duty, military, or learn more about how you can get involved, go to the Society's website, www.nationalmssociety.org/connections programs. And I will add as well, the MS Centers of Excellence also has a lot of resources as well. So if you're looking for support groups at the VA, you can contact the MS Centers of Excellence with the website over here on the webpage. Yep.
Great. Sounds like a lot of really great ways to get connected to resources, support, and community. Now, you all have shared so much valuable information, and so it might be challenging, but do you think you could give us a couple of takeaway points that you have for the audience? If they've missed anything, what are some key takeaways that you want them to take away from today?
Yeah, so I would just start by saying that, again, as mentioned before, VA Whole Health is not a checklist that one completes. It's not a one-time experience. It's really a fluid process. It's a framework for thinking about health and thinking about health in a more integrated and connected and holistic and comprehensive way than maybe some of the traditional healthcare models have talked about and approached health in the past. So it's really a process that can be used across the different phases of each of our healthcare journeys.
And I would add to that another takeaway point is really one of empowerment, finding your voice in your own healthcare. I think that's really important. It may be hard to find, but if you work on it, I think that it would really help with your healthcare. There are tools that really can help you. So find your voice and shout it out loud.
I love that. Yeah, I think that personal inventory assessment sheet is just good for anybody just to kind of reevaluate goals. I think that when we have something to work towards, it kind of keeps us consistent and motivated. And so I may be checking out that myself. So thank you so much for all the really great information. I want to kind of focus now on our time and addressing a few questions, since we have a little bit more time, that our audience has for you. So Katrina is wondering if the whole health approach allows for more time with a patient in an appointment. It always seems like doctor's appointments are always rushed, and how will they have enough time to work on all of these things with a patient?
Yeah, Katrina, that's a great question. So I think it's just about using time a little bit differently. So this model helps us all think about overall health and well-being in different ways. Some of the conversations occur during the appointments, but then there's also work that's done outside of appointments. And I'm not just saying for the veterans to do. Certainly the personal health inventory and using some of the tools is really important, but also for us as providers to do. So I know that I can say that when I have a veteran coming up on my schedule, I spend time before I meet with them to understand from review of their medical record what might be some presenting concerns, what might be aspects of their identity and background that are important to them. And then I don't make assumptions based on that. I make some hypotheses and I have discussions with veterans, and I invite those discussions in the work that I do. And then I incorporate that over time into our collaborative treatment planning. So again, this isn't something that's done at a single point in time. This is just a different way of thinking about health, a more holistic and comprehensive and collaborative way that can be used throughout one's healthcare journey.
So Richard, who's 70 years old and lives with MS, asked if the cognitive changes he's experiencing are from MS or dementia. And I know Dr. Dux, you kind of touched on this a little bit. So How is dementia different from the cognitive changes that we see in MS?
Yeah, just to build upon what I mentioned earlier. So there can be variability. So individuals with MS may experience cognitive changes directly related to MS or other causes. But again, talking kind of more generally, and what's typically observed is that cognitive changes are mild and they are not at the level of what diagnostically is required for a diagnosis of dementia. However, what I was just saying in terms of not making assumptions, asking, assessing, so cognitive and objective assessment is really a critical piece of this puzzle. So consistent with the National MS Society and other organizations for individuals with MS and different medical and mental health standards and guidelines, having an objective assessment as soon after diagnosis as possible, and then having ongoing assessments and screenings on an annual basis is really important. This provides a way to assess where you're at in terms of your thinking skills, to not only identify areas of weakness or impairment possibly, but also cognitive strengths. And these, your unique cognitive profile can be used to highlight a pathway for different points of intervention. And that is also true for different aspects of emotional and psychological health. So I think I mentioned before that we take a holistic person, veteran-centered approach to assessment. So we also objectively assess psychological well-being, and we also ask how you're doing. And we have different ways of doing that, different questionnaires that are used and other instruments, and try to integrate that information to come up with a tailored assessment report and plan that is most fitting for you at a specific time.
Dr. Lee-Wilk, do you have anything else to add about how dementia might be different from the cognitive changes seen in MS?
I mean, I would say, we don't know this gentleman's history, but I think an important thing, if he's really concerned, is really to get an evaluation. A neuropsychological evaluation is kind of the gold standard for cognitive assessment. So again, just like with mental health, treatment, he can talk to his primary care provider or neurologist and ask for say, these are my concerns and can I get an evaluation? Can I get a referral to neuropsychology? So that would be the next step I would take.
And I would just add too, so when we're differentiating between some cognitive changes and when would we say, yes, dementia is an appropriate term here. So dementia is essentially having cognitive impairment that far exceeds what would be expected based on your age and different factors. So we're not talking about a relative weakness or a mild impairment, but a more substantial change. And that's half of the equation of what's needed for a diagnosis of dementia. The other half of it is that these cognitive changes are directly impacting and negatively interfering with your ability to do day-to-day tasks. So if those two factors are present, that it consists of a diagnosis of dementia. And then the next step for providers in collaboration with veterans is to understand the different factors that might be contributing to that dementia and then trying to address those. But again, as we've been discussing for individuals with multiple sclerosis, it is possible to have a dementia, but that's not the most typical course. Most typically, it's milder symptoms that can impact and affect day-to-day function, but are not at the level of what is required for a diagnosis of dementia.
Well, that's really helpful to kind of understand those differences. This next question I really resonate with. So Macy knows her memory has declined and sometimes she can't find the word she's looking for. She wants to know if there are things she can do to help improve these areas.
Sure. Thank you for that question, Macy. I think that it's really important here to kind of differentiate between, kind of normalize. A lot of people really do experience, things like word finding difficulties. If she is really concerned about this, it's important to, again, get a neuropsychological evaluation, and that might be able to reassure her, because some of those things might be in the normal range. People can find at times that when they start thinking about how bad their memory is, they get stressed about it, and it's worse, and they sort of, catastrophize, thinking, oh, I must have dementia or something like that. So a lot of times having an evaluation can be reassuring to sort of say you do or you don't have true impairment. But from there, once you have that information, I think doing things like cognitive rehabilitation, or just getting some strategies, even like a 1 or 2 session kind of treatment plan to say, here are some strategies, here are the main things that I'm having difficulty with. So again, whole health and the personalized, individualized care plan based on what is important to Macy and what's impacting her daily life is where we're going to be at our starting point for treatment.
Yeah. Well, and I know you mentioned other things can be contributing factors. I know, like when I notice having a hard time word finding, it's because it's been a really long day or stressful day, or the heat sometimes can impact that. And so even like being aware of those things, I think would be helpful.
Absolutely. And I think for each person, it might be different. It might be heat for one person. It might be, fatigue for another person. So getting to know what your triggers are, and then, pacing yourself and giving yourself some breaks, I think it would be really important.
Yeah. Great. Well, thanks to everyone who submitted your comments and questions. And thank you, Dr. Lee-Wilk and Dr. Dux, for being with us today and sharing your insights. We really appreciate it. Before we close, I'd like to remind everyone that you can connect with an MS Navigator via phone, email, and through the Society's website via chat. For information and resources on MS, visit the Society's website. You'll find research updates, news, self-help groups just for veterans and active duty military, and more ways to get involved and upcoming events near you. To learn more about veterans and MS, visit www.nationalmssociety.org/veterans. You can connect with the National MS Society and others affected by MS via Facebook, Instagram, Twitter, YouTube, and LinkedIn. I encourage you to like and subscribe and/or get on the Society's mailing list to continue to receive up-to-date information on MS and updates on upcoming programs. Thank you again, Dr. Lee-Wilk and Dr. Dux, for sharing your knowledge and for everyone's engagement in today's program. The recording will be made available on the Society's website at www.nationalmssociety.org/MS expert. Lastly, it's important to get your feedback on today's program. You'll see a survey linked to the comment section on YouTube. Completing the survey makes a difference, and it only takes 1 minute to complete. So the information you provide helps continuously improve and shape our future segments. Thank you so much for joining us, and we will see you again soon.